grieving. Some families will be lost to one another forever. To those of you who face the difficulties of reconnecting with family and establishing ongoing relationships, we say sorry. We offer this apology in the hope that it will assist your healing and in order to shine a light on a dark period of our nation's history. To those who have fought for the truth to be heard, we hear you now.
You're listening to Adopt Perspective, a podcast for anyone affected by adoption. I'm one of your hosts, Jo Sparrow. This podcast is a production of Jigsaw Queensland Post-Adoption Support Service. However, the views expressed are those of the people participating, not necessarily Jigsaw Queensland. The podcast discusses adult themes and listener discretion is advised. Welcome to Adopt Perspective. I'm your host, Jo Sparrow. Following on from our recent episode about trauma yoga, today we're exploring another therapeutic option for people affected by adoption. There's no one-size-fits-all approach when it comes to seeking help, and these episodes are more about investigating possible options rather than recommending any one. Today we're discussing eye movement desensitization reprocessing, or as it is better known, thankfully, EMDR. I think I'll be sticking to that acronym today. To help us with this overview, we'll be talking to Fiona Mawson. Fiona is a counselling psychologist and registered and accredited EMDR consultant with the EMDR Association of Australia, and she has an EMDR focused practice in Victoria. Fiona, welcome to Adopt Perspective, and thank you so much for sharing your time and expertise.
Oh, look, thanks very much for inviting me and for your interest in EMDR. I'm absolutely delighted to be here, and I'm really excited to be talking about EMDR, and I'm hoping that your listeners will take away from this conversation and do their own research and explore whether or not it's a good therapy for them. So thanks for inviting me.
You're welcome. Fiona, I recently read two analogies of EMDR. One was that it is using our brain to colour in an old memory, and the other is that it's like visiting the dentist who cleans out the decay in our tooth and then places a healthy filling in that spot. Is there any truth to these analogies, and what exactly is EMDR?
Well, I actually haven't heard those analogies, and I think they're really interesting ones. I like to think it a little bit differently to that, which is, I think the human body is designed to heal. It always wants to heal itself, and sometimes it needs help, but for the most part, it wants to heal itself. And so, if we cut ourselves, the body's natural healing process will kick in, and the cells will do what it wants to do. And it's kind of the same with EMDR. It's both a physiological therapy and a psychological therapy. And because we know that memories are stored in the brain, in a particular part of the brain, then because the brain has stored the memory, and it's disturbing, then the natural healing capacity of the brain is to want to heal that disturbance. And that's why psychologically people seek therapy, and that's why physiologically the brain also does its thing to help to heal itself. So in terms of what is EMDR, let's do a little bit of a history walk, because I think that's really important sometimes.
Yeah.
So it was first developed in 1987 by Dr. Francine Shapiro. Now, Francine, she's late now. She passed away about 3 years ago. What happened was she was walking in a park, and she actually at that time had cancer. And she was walking in the park, and she was feeling really disturbed about her condition. And as she was walking and thinking, she noticed that her eyes were moving in a particular way. And she got really curious about that, because she noticed that the disturbance in her body and her emotions about her condition reduced. And as a psychologist, we're called scientific practitioners. And so we like to look at the science of what's happening in the human condition. So she went back and actually created a study which was looking at how memories can be, the trauma or the disturbance in a memory can be reduced by using eye movements. And went on to, in 1987, I think it was, around that time, she did this study which was published, and it sort of gained traction from there. So that's kind of the history of EMDR, and now it's been operating, or it's been used as a therapy for over 30 years. And it's very well understood and researched and recognised. And I'll talk a little bit about that later. So let's tell you what EMDR is, because it's an interesting little therapy. It's first of all, it's person-centred, which means that the therapist is really focused on what the client needs, and is really empathetic to the goals and the things that the client wants to change. And as I said, it's both physiological and psychological. It has those two elements to it. So it incorporates eye movements, and they can also be not only eye movements, it can also be listening to tones on earphones. It can be butterfly hugs, which is where you tap, and if you can hear me tapping on my arms. And there's a thing called a light bar, so people can use a light bar which moves left to right as a light moving, and that helps the eyes to move left to right. And you can also use the thing called theratappers, which are like buzzers that you hold in your hands, and the person has this buzzing from one hand left to right as they think about the disturbing material. And we call all of that bilateral stimulation, or BLS, and that's a key element to EMDR that puts it and makes it different to a lot of other therapies. So the therapy itself is really structured and systematic. It's very procedurally based, and it has a set way of doing it, which is why the evidence for it, one of the reasons for why the evidence for it is growing, because it's replicable. And so we know that if we follow the procedure, we're going to get the best results for our clients. Whereas if we just do anything we like and just do eye movements, we may not get the best results. And what we believe is that the eye movement, or the BLS, however that is, the tones or the tapping, it actually stimulates the neural pathways in the brain. And that's what helps the brain to heal itself. And we kind of know this, because when we go to sleep at night and we sleep, we go into a particular sleep pattern called REM sleep, or rapid eye movement sleep. And if you think about it, like I know you've got a lovely dog there. And
I do.
So I hope your listeners don't mind me telling them that you have a lovely dog.
They've heard him on quite a few occasions.
Oh, that's good. So when you notice your dog sleeping, you'll know that he or she is dreaming when their eyes start flickering, and you'll see their body twitching, and they'll be groaning and roughing and whatever it is that dogs do and talk in their sleep. It's the same for human beings. We all go into REM sleep, and the brain naturally wants to process information. And when we're in REM sleep, what do our eyes move? That they move left and right and up and down. And we believe that that's the neural pathway being activated. And so that's why the eye movements are typically used for EMDR therapy. Just so that kind of goes into that a little bit. So it's really about EMDR therapy is really about processing disturbing events that have been stored in the brain in a systematic and structured way to support clients so that they don't become overwhelmed when the emotional content of memories come up for processing.
That is a fantastic explanation. Thank you so much for that. And I love how, now I've forgotten her name, but the lady that discovered it, what a great lot of mindfulness that she had, in that moment to notice what was happening and then thinking there's something to this and exploring it further.
That's right. And it's been the most wonderful gift, I believe, to the whole world, because EMDR is used everywhere across the planet. And it's used not just for post-traumatic stress disorder, which is what it was initially researched on, but a whole range of different presentations that people have. And, I won't certainly sit here and say it's been an easy journey, because there was a lot of skepticism about EMDR in the early days. And there was a lot of pushback by certain psychologists and researchers who have a particular passion about their own therapy. However, when the World Health Organization recognizes it as a first order treatment for PTSD, and it's in many different guidelines across the globe as a recommended treatment, then those sorts of arguments really become a lot quieter.
Yes, yeah, I imagine they do. So what got you interested in this area?
That's a great question. So there was, and this is a bit of a confession.
Good, I like those. I'll lean in close.
just between the two of us.
Okay.
So I as a psychologist, excuse me, I have lots of complex clients sometimes. I'll just have a drink of water.
Sure.
And I had this one client who I love all my clients. You shouldn't love your clients, but I do. And I just felt like I was failing her, because the therapy that I was using, it just didn't seem to hit the mark. And I just felt there's something missing here. There's just something's not working. And that's what we do as scientific practitioners. We ask ourselves those questions. So I started looking for a therapy that I could try with her and learn in order to help her. Mm-hmm. And I thought, oh, gee, EMDR, never heard of that. I wonder what that is. Oh, wow, there's a training in New Zealand. I can go to New Zealand and learn EMDR and have a holiday. And so that's what I did.
Yeah.
And so that's what really got me interested. And after that, it just transformed my whole practice. I really became passionate and interested and researched and trained until I, became a consultant. And so that was, that was my journey, really.
That's fantastic. Thank you. So what can you tell us then, I guess, about how trauma impacts the brain?
And that's a really complicated question. And I'm definitely not a brain specialist. And I wish I was, because I think that would be a really interesting skill, but I can only learn so much. But what I'll do is I'll just take you around the parts of the brain that we know are impacted by trauma. And those three parts of the brain are the amygdala, the prefrontal lobe, and the hippocampus. And I'll just do a very general explanation of what they are and how trauma impacts the brain. in a little bit. But before I do that, I really want your listeners to take on board that trauma doesn't just impact the brain. Trauma impacts the social relationships that people have. It impacts self-identity. It impacts on the core belief that people have about themselves in terms of, am I safe in the world? Is the world a safe place for me? And so, although EMDR is very much a brain-based therapy, it also looks at attachment and the attachment injuries that come from trauma. And particularly for your listeners through the adoption service, I'm assuming that's what Jigsaw is. If that's wrong, I apologise.
No, we are, yeah, post-adoption support service, yeah.
Thank you. I did think so, but I wasn't sure. Is that, some of your members there, or the people that come to you for help, would know that they have experiences from their childhood or that are impacting on them. And they have these core beliefs about themselves, as we all do. And those core beliefs create disturbances. And then those disturbances change how we react and we behave in relationships and at work and in all sorts of settings. So, really, when we talk about trauma impacting the brain, I like to really broaden that. It's not just about the brain.
Yeah.
But back to your question. So the amygdala, there's the three parts of the brain. The first part is the amygdala. Now, the amygdala is the emotional center of the brain, and it's also the part of the brain that responds to threat in the environment. It's called the fight-flight center of the brain, and it kind of interprets the environment and then responds. And it's the heightened attention to the environment that leads people to be vigilant, to be anxious, to be worried, to jump if a door slams, or to be walking down the street and they might see someone and it reminds them of someone else that hurt them. And so the amygdala is the threat alert system. And we know for people that have been traumatized that the amygdala is often always switched on. And so they're waiting for threats, they're waiting for things to be bad. And that's very exhausting for the whole system as a body, because that impacts on the nervous system. So that's one of the things that happens with trauma on the brain. The second area of the brain that gets impacted is the prefrontal lobe. And that's right at the start of at the top of the forehead here. If you touch the top of your forehead, you're touching your basically your prefrontal lobe. It's called the medial prefrontal lobe, but that's just too complicated for me. And this is the part of the brain where you think and reason and coordinate and problem solve. And so what sometimes happens is that when the amygdala fires up and is on alert, there's a whole lot of chemicals get released, and that in effect shuts down the prefrontal lobe and our ability to think calmly and rationally and to problem solve. And we know this happens. Everybody will know when they go to present at a talk, or for me, when I came to talk to you this morning, my amygdala was fired up and I was anxious, and so my prefrontal lobe started to shut down, and I thought, I have my notes, Fiona, you're okay. And so that's how trauma impacts the relationship between those two parts of the brain. And then the third part of the brain that gets impacted by trauma is the hippocampus. And its function is learning and memory. And so what we know about the hippocampus is that when a trauma event occurs, the hippocampus can store it in state-specific form because it's a really big event. So, the hippocampus will store the image, the sound, the body sensation, the smell, the taste, and often the thought that goes with it. And it's that storing the memory in state-specific form that leads people to re-experience the trauma in everyday life. Because they're walking down the street and they see someone that reminds them of someone that hurt them, and straight away, because it's a learnt memory and it's stored, the hippocampus goes into flight mode, and then the prefrontal lobe shuts down, and then all of a sudden the person doesn't understand why they're anxious, worried, and they just want to get out of that environment. So that's kind of my very basic sort of explanation. And but as I've said, the brain wants to heal. It really does. I 100% believe that. It just needs some support and some help to do that. So I hope that was clear.
It is clear, and I love that you say that the brain does want to heal itself, and it's certainly been my experience. Sometimes, it might go some odd ways about that, but it is bringing back, coping mechanisms or its own attempts to heal. So, yeah, that's fantastic. It was a great explanation. Thank you.
Oh, my pleasure.
So then, does EMDR erase memories? What does it do?
Okay, that's a great question. It depends on the client. I've definitely had some clients where I've processed a memory with them, and the next week when they've come back and I've asked them to bring up the memory, they've said, Fiona, I know it happened. It's a narrative, it's a story. I know I was involved in a car accident when I was 10 years old. But it's like I don't have the state-specific knowledge of it. I can't bring up the image of the car anymore. I can't bring up the smell of the glass. I can't hear the sound of the car engine. And so for me, that's as close as you're going to get to an erased memory, because we don't erase the facts of a person's life. There will always be a narrative that this happened and it happened to me, but I was whatever age I am. And that's a great outcome for that client and for clients that have that experience. But more often than not, what the clients will report is, I still have the memory, but it doesn't disturb me. And not only does it not disturb me emotionally or psychologically, I no longer feel as though I have a negative belief about myself that's irrational. And we know that there are typically things that happen for children in particular. The child comes home, gets a glass of milk, puts the glass of milk on the bench, and then knocks it over. And mum or dad's having a bad day, and gets out of their window of tolerance and yells at the child, little Johnny or little Jane, how could you do that? You're just silly, you're clumsy, and you're stupid. And so the child then says, I'm stupid. And then that core belief gets embedded in the hippocampus and stored in memory in state-specific form, and starts to have an underlying belief that starts to run as a pattern through the child's life into their adulthood. And they become sensitive to criticism and sensitive to doing things wrong. And so when we go back and process that memory, the child then has an adult perspective, which is, oh, I was just a kid. Kids are clumsy. And, mum and dad, they were pretty good people. They were, they're just having a bad day. And they did the best they could. And so that's kind of typically what can happen. And the other thing that typically can happen for memories is that they actually change. And so I've had people have a memory where they might have been trapped in a room, and then when I process the memory, or they process it, I just help them. The next week when they come back, they'll say, I'm not even in the room anymore. I'm on the beach, I'm having a great time. and that typically happens. Or the image changes. It's not in colour anymore, it's in black and white, or it's distant, or it's far away, or it's in the past. All sorts of interesting things happen because that's what the brain does. It wants to heal. It wants to grow, to progress, to change.
It's incredible. So that kind of leads me to something else. And I guess adoption affects many people, but for today's purposes, we'll focus on mothers and fathers who have lost children to adoption and adopted people, who are, the people that we mostly assist through Jigsaw. For all parties, lack of memory can be an issue, and for a multitude of reasons. It could be repressed memories or the influence of prescribed medications at the time it happened, to name only a couple. And for adopted people, the trauma of separation and adoption is even more complex, as it was often pre-verbal. So there is literally no actual memory of the events. So I guess I'm asking, what if someone doesn't have a memory of the traumatic event? How can EMDR help?
That's that's really interesting. So from a baby's perspective, actually, before I start that, I'll just share with your listeners, and as I shared with you, Joe, which sort of really encouraged me to speak to Jigsaw, was I have a family member who gave up a baby for adoption many years ago. And so I've sort of been journeying with that with my family member over that time. And so, it's sort of, I can see exactly what you're saying there from a lived experience. And so, let's go back to your question. So let's look at a baby. So let's say a baby is born, and then it's cared for initially in the hospital, and there may have been some bonding opportunity, or may not have, between the baby and the mother. And then the baby's given up for adoption. And as sometimes happens, they may go into a foster arrangement for a certain period of time, or they may go straight to their new parent, their new mum and dad. Now, when the baby is first born, though, it has an experience of the birth mother, or the biological mother, however is the best term to use for that individual person, and that baby has an experience of the smell, the feel, the hold, the words, and they've been experienced all through the womb, all through the gestation period. And so sometimes what can happen is when the baby gets, given to a new loving family, it feels different. The smell is different. The hold is different. All sorts of things could be different. And so sometimes with clients that I've worked with that have had that experience, they don't have a verbal memory. They don't have a story. They only know that they were adopted as a child, but for some, not for all, they have an underlying feeling or a sense that something isn't right in themselves, in their body sensations. And so instead of processing a specific memory, I make up a narrative about their adoption, and then we focus on the sensation in the body. And these are for pre-verbal traumas, if it's a trauma, and so we process the physical sensation, and often the person will just naturally start to resolve and to consolidate that negative sensation and negative core belief into something that's more adaptive and positive. For other people who have specific memories, then that's a different approach, because you have a specific story, a beginning, a middle, and an end, and a negative belief, and a disturbance, an emotional feeling. But often it's stored in a way that's really unhelpful with whatever the negative belief is. And so by processing it, no matter how long ago it happened, 20 years ago, 30 years ago, 50 years ago, it makes no difference to the brain. It's stuck in that time, at that date. And so the person holds that memory at that time, and we just work with that. It's really interesting, and it's a relief. It's a relief for someone to say, I've held this for 30 years and now it just doesn't disturb me. And I made the best decision I could at that time. And I'm okay with that. It's, it does, for me, it doesn't get better than that in therapy.
One of the things that stops people sometimes from seeking therapy is the thought that it's going to bring it all up, that it could be re-traumatizing. What prevents EMDR from re-traumatizing one of your clients?
And that's the reason why I went and I learned EMDR, because I felt that the therapy that I was using was re-traumatizing them, and it was just too distressing. So a couple of things that are different between EMDR and something like trauma-focused CBT or some of the other therapies is that it doesn't have a homework component. So we never ask the client after a therapy session to go home and think about it, and to write about it, and to talk to other people about it. We don't want them to do that. We want them to do the therapy in the room in a contained and supported way. The other thing that's not so re-traumatizing is that we don't want to know the story necessarily as a therapist. I don't need the intimate details, which can often trigger shame. I don't want to know the intimate details, which can often be traumatizing for me. And so we just want a little narrative, which might be, when I was 15, I fell pregnant and I gave up a baby for adoption. And that's all I need. And then we just take an image of the worst moment, a picture in time, and then we start our assessment of that image, and we process that, and that's how we process the memory. And that's why I believe it's gentle, it's less traumatizing, and there's a lot of skills that go into helping people to not be overly distressed and outside a window of tolerance, so that they can process it comfortably. But that's not to say it's not an easy therapy. People will get distressed and they will become emotionally upset, but that's not new information for them or experiences. They've had it all their life. But at the end of the session, 9 times out of 10, they'll say, I haven't got that disturbance now.
Yeah. So how does EMDR differ to, say, hypnosis?
Well, it's definitely not hypnosis. Hypnosis is where the client sits quite passively in a chair, and the hypnotherapist talks to the subconscious and embeds sort of subconscious messages in the brain to help the brain to heal. EMDR is really active. And so the client is asked through the phase 3 assessment to bring up the memory after phase 3 assessment, when they're desensitizing the memory. They're actually asked to bring up the memory, notice the worst moment, and then you say, and now follow my hand. And with their eyes, they follow your hand. And when you finish after about 20 movements, you then ask the client, so what are you noticing? And then the client feeds back what they're noticing, and it could be anything, in the memory, out of the memory, an image, a sound, a body sensation. And then you just say, okay, notice that. And then off you go again with the eye movements. And so it's very different to hypnosis. It's very different to talking therapies, where people just talk and then they talk, and then the therapist says, oh, that must be terrible. And then they talk some more. And the therapist says, oh, I can really understand that. It's not like that. The client does the work, and I just sit back and support them.
Yeah, that's fantastic. Thank you. So what could somebody expect when they participate in EMDR therapy?
All right, so the first thing that's going to happen is the clinician should explain what EMDR therapy is and some of the challenges and concerns that come up, particularly around, emotional disturbance, and can the person tolerate emotional disturbance. And so we actually teach people how to do that with an EMDR technique to tolerate, to go into disturbance and out of disturbance, into disturbance and out of disturbance. So the first part is the psychoeducation. Then the second part is that we want to take a complete clinical landscape. We really want to know about this person's life story, and we're really specific. Well, I am. So I will ask, tell me your 20 worst memories in your life. And if they sort of can't give that to me, I'll say, tell me about a dental appointment you had that was really bad. Have you ever had any operations, any car accidents, any natural disasters, floods, cyclones, bushfires? The moment in your life where you felt most shameful, the worst Christmas. Who in your family don't you like? Is there someone you feel really uncomfortable around? And then that gives us what's called a clinical landscape and a targeting sequence. And then once we've got that, we then sit down with the client and ask them, what are their goals in therapy? What are they presenting with? And they might say, oh, I can't get on public transport. And so we look at the memories that they've given us, and I say, oh, when you were 8, you got abused on a train. This is really typical for me. And they'll say, yeah. And I say, okay, well, let's process that memory. And so we then set up that target memory. We process it to adaptive resolution, or where there's no disturbance. And then we look at, has there been any change in the client's ability to travel on public transport? And we test it. We do all sorts of things around making sure the treatment that we're providing is getting results. And we look at past memories, current triggers, and we want to do a future template, which is, in the future, can you see yourself getting on a train and being really comfortable and not being worried about these thoughts of not feeling safe? And typically that just progresses through to however many sessions we have with the client.
That's fantastic. Thank you. So I guess then it can be done by somebody who's visually impaired, because there are the other options besides, the eye movement as the bilateral.
That's right.
Yes.
You're getting there.
I'm getting there. I could be an expert by the end of this.
You're doing very well. Look, I've had some trainees who can't remember bilateral. That's okay. Then you just help them along, and they do very well. So if you're blind or if you're deaf, you can definitely do BLS and do EMDR therapy. And I guess the more complicated, those are actually quite easy, to be honest, but the more complicated client is those that might have high levels of dissociation. And so if you know that you are a person who dissociates in order to cope, because it's a coping strategy, then my recommendation is to always find an accredited practitioner, and preferably someone who's really had training in how to work with traumatized people with dissociation. Because that's when it can be really challenging for the client if the therapist is not as skillful as they really need to be for that client type.
Yeah. Just for our listeners, when you say disassociation, what do you mean?
Oh, okay. So let's go back to how trauma impacts the brain. So the client has oh my goodness, Fiona, the person has a trauma event, and in order to survive, the brain, this is a survival strategy, the brain says, I don't want to remember that. Because if I remember that and feel that and experience that, then I'm not going to survive and function. I have to get up and go to school tomorrow. I have to go to work. And so the brain, in a very clever way, separates the memory out and represses it or blocks it.
Yeah.
And that's kind of like it dissociates it from the experience, the lived experience of the person. And so when we go into a trauma memory for processing, what do we want to do? We want that memory. And so you really need to be skillful that if your client has blocked a memory or repressed a memory, that you know how to work with a client so that the part of them that did that isn't going to be cranky about it. And they're not going to go and do other behaviours like drinking alcohol or gambling or self-harming, because they don't want to feel that memory. And my therapist wants me to. I don't want to feel that. So I'll go and do something to distract that's problematic.
Yeah. Which I guess leads to one of the questions I had, which was, is there any situations where EMDR might be ineffective or not suitable?
So there definitely are situations where it shouldn't be jumped into quickly. And so you want to assess for drug and alcohol use, people that are suicidal. If someone's not in a stable home environment, if someone is in a psychotic episode, then for the average everyday sort of EMDR therapist, they would need to do lots more preparation and stabilization for that client. Yeah. For other therapists who might be more skillful, though, those sorts of comorbid presentations or problematic behaviours can be worked with through other strategies and skills that the therapist will have, so that we don't want to have the client revert to those problematic behaviours. But EMDR can be used for people in psychosis and for people using drugs and alcohol, because there are protocols that are developed to support those presentations.
Mm-hmm. Great.
But they need to be skillful. The therapist needs to be skillful.
Yeah. I guess, and that's one of the things, sometimes you might go to a therapist and it's not a good fit, and so you have to be willing to not just necessarily give up on the whole idea of EMDR or whatever therapy, but maybe looking for a different person.
That's right. And you can always try and find the right person by asking them about their training. Who did they train with? And how many years have they been doing EMDR? And, I've been told I dissociate. Can you work with me if I dissociate? Or, when I was a teenager, I used to self-harm to cope. Do you know how to work with that? And they're great questions to ask any therapist, no matter what approach they're using.
Yeah. So with the pandemic, it's greatly increased the number of people who are seeking mental health support just in general. And it's also made face-to-face consultations harder at various times. Can EMDR be done virtually?
Absolutely, it can. Not a problem at all. There are special sort of considerations you have to take in place, though, and put into place, like making sure that you've got good connectivity via the virtual medium. That if the client is dysregulated, then there's a support network around them. That there are things that the therapist has to do to make sure that online EMDR is safe for the client. And there's a whole lot of different ways to do EMDR. People have developed programs with a light ball that moves across the screen. Put earphones on to listen to the audio BLS being delivered, or we do a thing called a butterfly hug that was developed by, I think it was Harara Nacho, if that's right. If it's not, I apologise. And that's a group-based protocol where for people, it was actually developed for children in a war zone, where they would all come together. They would do this tapping on the left and right arm, and that was how they applied the BLS in a group setting. And now, of course, we're using it for online EMDR.
Yeah, fantastic. So if any of our listeners are curious about EMDR therapy, where should they start?
So the best place to go is to the EMDR Association of Australia website, which is EMDR AA. Every registered EMDR therapist in Australia who wants to be is on that web page, and it lists whether they're a member, whether they're an accredited practitioner, or whether they're a consultant. And so it'll also list it by location. And so then what they would do is they would contact the practitioner by email and ask, have they got any capacity to see clients? I'll be honest, a lot of EMDR therapists are really booked up, and I myself have very limited capacity for new clients because I consult. But sometimes if this is my experience, if you write just a little story about yourself and the books are closed, then some therapists might say, oh, that's really interesting. I think I might see what we can do with this client. Or the therapist will say, I'll put you on my wait list. Better to go on a wait list than not, because eventually your name will come up. That's just my experience. And so, yeah, so it's really hunting around and asking the question and trying to find the best fit.
Yeah, thank you. Yeah, it's been my experience too, just booking for family members that have wanted to see different practitioners, that if you go on the wait list, quite often I've been contacted really quickly after they've gone on the wait list, and been able to, you know, so long as I'm prepared to go in the next day or that day, we can get in there really quickly. Yeah, that's right.
And then most therapists, once they have a client in their, you know, in their diary,
you get regular.
Yeah. You become regular. Yeah. It's just getting in the diary. That's the challenge.
Yeah, definitely. Look, this has been an absolute amazing interview for me. You've been wonderful. I really feel like that I have a great sense of EMDR now. So thank you so much for your time and sharing your expertise with us today, Fiona. Is there anything that you would like us to know before we finish up today?
I think the only thing I would like the listeners to know is that, you know, I really believe that we all have the capacity to heal, and that we really want to be the best selves that we can be, and that when we were born as children, as little babies, you know, we had all these experiences in our life that formed and developed us into the person that we are. They're learned experiences. They're stored in the memory banks. They're interpretations of life. And if we've learnt something, then we can actually unlearn it. And so if we've learnt a particular belief about ourselves, we can unlearn it. And if we've got an emotional disturbance that is disturbing, well, then it means we've got an emotional feeling that's great and positive and loving and warm and comfortable. And so we can help ourselves to move towards that experience and to bring joy and happiness to our lives. And, you know, EMDR is not for everybody. It's just, it isn't, and it isn't for every presentation. But if you give it a go with the right fit and the right approach, then you may actually find some changes that will be quite delightful.
Thank you. And we'll put up some of the relevant links on our podcast notes page, particularly the EMDRA website that Fiona mentioned. So be sure to check them out. In the meantime, do you have a story that you'd like to share with us? If so, jump onto the main podcast page of the Jigsaw Queensland website and complete the prospective guest form that you will find there. And note that Adopt Perspective can be listened to by people all over the world. Bye for now. Thanks for listening to the Adopt Perspective podcast. If you'd like to find out more, go to the podcast page on www.jigsawqueensland.com and you'll find a wealth of information and resources on the website. If you reside in Queensland, you can reach Jigsaw Queensland's Forced Adoption Support Service on toll-free 1800 210313, or you can call Jigsaw on 07 33 58 6666. If you live in another state of Australia, you can still call the Forced Adoption Support Service number and your call will be answered by the Forced Adoption Support Service in the state that you are calling from. In every other state, Relationships Australia operates this service. A big thank you to Matt Sparrow for composing and recording our original theme music. Until next time, I'm Jo Sparrow saying farewell from Adopt Perspective, a podcast for anyone affected by adoption.